Welcome to Nursing-Related Philippine Jurisprudence, written and narrated by John Igor T. Galinato. This next case is captioned Sps Flores versus Sps Pineda, GR number 158996, November 14, 2008. The facts of this case are as follows. This case, classified by this author as a problem in assessment, Dr. Frederico Flores, an anesthesiologist, scheduled the DNC, or dilatation and curettage, to be performed by his wife, Dr. Felicissima Flores, a surgeon, on a woman with alleged vaginal bleeding, despite the fact that the said woman also has diabetes mellitus. The issue in this case is whether or not the doctors are solidarily liable. This is so because the operation on the woman caused surgical stress, increasing her blood sugar level and causing her to have complications diabetic ketoacidosis. As to their liability, the Supreme Court ruled yes. The Supreme Court held that the surgical stress indeed aggravated the patient's hyperglycemia, killing her. The evidence strongly suggests that the preoperative evaluation was less than complete, as the laboratory results were fully reported only on the day following the DNC operation. The doctors at the hospital were found solidarily liable for 686,000 pesos. The Supreme Court noted that dilation and curettage is the classic gynecological procedure for evaluation and possible therapeutic treatment for abnormal vaginal bleeding. The expert witness, Dr. Mendoza, explained that increased sugar level caused by the diabetes mellitus should have prodded the respondent doctors to postpone the DNC operation. Further, the Supreme Court noted that there was no profuse vaginal bleeding at all, which the respondents had used to justify the DNC. Said vaginal bleeding was not reflected in the medical records, and there was no immediate need for the DNC procedure as it was only diagnostic. Citing medical literature, specifically Kelly's textbook of internal medicine, 4th edition, the Supreme Court ruled that in an elective procedure, the physician must conduct a thorough preoperative evaluation of the patient in order to adequately prepare her for the operation and minimize possible risks and complications. Surgical stress can aggravate the patient's hyperglycemia. Medical literature further explains that if the blood sugar has become very high, the patient could become comatose with diabetic coma. When this happens over several days, the body uses its own fat to produce energy, and the result is high levels of waste products called ketones in the blood and urine, a condition called diabetic ketoacidosis, a medical emergency with significant mortality rate, citing Gordon French, MD, Clinical Management of Diabetes Mellitus during anesthesia and surgery, September 21, 2008. In this case, the respondent doctors were held civilly liable for actual damages, 36,000 pesos for hospital expenses, death indemnity of 50,000 pesos, moral damages of 400,000 pesos, exemplary damages of 100,000 pesos, and attorney's fees of 100,000 pesos, or a total of 686,000 pesos. The elements of medical negligence in this case were established. A medical negligence case is a type of claim to redress a wrong committed by a medical professional that has caused bodily harm to or the death of a patient. There are 4 elements involved in a medical negligence case, namely duty, breach of duty, injury, and proximate causation. Duty refers to the standard of behavior which imposes restriction on one's conduct. The standard, in turn, refers to the amount of competence associated with the proper discharge of the profession. A physician is expected to use at least the same level of care that any other reasonably competent doctor would use under the same circumstance. Breach of duty occurs when the physician fails to comply with these professional standards. If injury results to the patient as a result of the breach, the physician is answerable for negligence. As in any civil action, the burden to prove the existence of the necessary elements rests with the plaintiff. To successfully pursue the claim, the plaintiff must prove by preponderance of evidence that 1. The physician either failed to do something which a reasonably prudent healthcare provider would have done, or that he did something that a reasonably prudent provider would not have done, and 2. The failure of action caused injury to the patient. Expert testimony is therefore essential, since the factual issue of whether a physician or surgeon has exercised the requisite degree of care and skill in the treatment of the patient is generally a matter of expert opinion.